Welcome. I'm Dr. Vinay Prasad. I'm a hematologist oncologist, and I'm associate professor of medicine at the University of California, San Francisco. In my professional life, I see patients, I teach trainees, and I do research in healthcare policy. This is Plenary Session. Plenary Session is a podcast at the intersection of medicine, oncology, and health policy, and you're listening to Season 3. On this week's episode. This week on Plenary Session, I'm joined by Tracy Høeg. She's an epidemiologist and a sports medicine doctor, and she's one of the authors of a new paper that came out in the Morbidity, Mortality weekly reports of the CDC that looks at the Wisconsin experience on schools and finds, surprise, surprise, it's safe and you better open them. You won't want to miss this discussion. If you like this podcast and want more content, follow me on Twitter at vprasadmdmph. Check out the YouTube channel, Vinay Prasad, MD, MPH. Patreon backers will get access to the slides for lectures I give on Plenary Session. Want to hear from us? Email us your question at plenarysessionpodcast@gmail.com. Okay, I'm back in Plenary Session, joined via Zoom by Tracy Høeg. Dr. Høeg is a sports medicine physician. She's also an epidemiologist, and she's the author of a very new and interesting study about the Wisconsin experience and opening schools in the time of COVID. Dr. Høeg, it's a pleasure to speak with you today.
Thank you, Vinay. Thanks so much for having me. It's a pleasure to be here. I really love your show.
Oh, thank you. Well, I'm a big fan of your Twitter account, and I have to applaud you because, I think, I'm drawn to this issue as a policy question, but I think it's probably, in retrospect, will be probably the most important question that we have faced throughout the pandemic, which is, when and how and under what circumstances can we open schools? And I would say, listeners to this podcast will know where I stand on this issue. They've heard me to death on it. I wonder if you might talk about, I guess, your background is in, we were talking just a minute before we came on, and your background, of course, you're a physician, you're a PM&R doc, you do sports medicine. You also have trained in epidemiology. You've done epidemiology work. I wonder if you might talk a little bit about where you were when COVID struck and some of your initial thoughts on the response and schools, and then maybe a little bit, then I'll ask you how you kind of got into this kind of work and up to the recent paper.
Yeah, absolutely. That's a great question. So, I work in sports medicine in Grass Valley, and that's where I was working when all this started, and was watching very carefully from China. And very early on, I was a proponent actually of locking down and shutting down schools. And interestingly enough, there was actually a case in a teacher in one of my kids' schools. And I thought, wow, that's crazy and she ended up dying. Wow. And then it was learned a couple weeks later that she didn't contract it in school. She contracted it in church. And then that was kind of the first kind of thing that caught my interest. And I thought, well, that's a little bit weird because no one ever followed up on that. And everyone always said she caught it in school, but actually she didn't. And then I was, following closely in the spring what was happening with schools. Well, I have 4 kids, and if that's an obvious reason I was following it, but also because Denmark was really the first country in the world to open up their schools, and that was on April 15th. Sweden had kept them open all along, but Denmark locked down, a very strict lockdown, and the first thing they opened up was their elementary schools. And because I'm Danish, I was following that closely, and we watched the Danish news in our house, and they were able to do it, opening up with 6.9% test positivity rate at the time. And after that, the cases just plummeted, and the whole society basically rallied around opening up the schools. And they actually opened up like Tivoli theme park to hold the schools there. Yeah. And Girl Scouts and Boy Scouts clubs. And they were able to get the kids in situations where, there was enough space between them, and they spent a lot of time outdoors, and they were really creative about it. And it worked so well because they really didn't have any transmission from opening up the schools. Like I said, the cases just went down from there. But the Scandinavian society, they prioritize kids I've learned in a different way than our country does. So yeah, they started with the grade school, then they went to the secondary schools to open those up, same story, and then they opened up the rest of the economy. And we'll probably get to this, but interestingly enough, they were not wearing masks in the schools all along until around October. And now I think it's still just ages 12 and over, they're wearing masks now. So it's been a really different approach there. And actually Denmark has been really different from Sweden too, which a lot of people don't know. But
So I see. So this is, I mean, I've also followed that with interest. I thought it was, I talked to a colleague in Switzerland, and he basically told me something very similar, that Switzerland had a stop for 4 to 6 weeks, but then schools resumed rather quickly. And that is the experience, I think, across Europe, which is that Europe has prioritized schools and made much more of a concerted effort to reopen schools. And of course, this was a time of uncertainty, but we were rapidly learning in March and April and May that thankfully the virus, which is extremely lethal in older people, is thankfully orders of magnitude logfold less lethal in children. And we're talking about, a JAMA paper that came out in the fall that I think looked at the experience from March till October, found that 1 in a million children during that time passed away of SARS-CoV-2. Whereas it was 7,500 times higher in 80-year-olds. So school was certainly safe to kids. And these other nations, I think, realize that school is an important thing for children, for their lives, for their mental health, for their well-being, for hot meal. So now tell us, in this country, of course, we went into shutdown and things were probably shut down until the school year ended and the summertime came. Then, in California, the case rates were rather low in the summertime. And tell me, what was going on in your thinking, as fall was approaching, as we reached July and August? What was going on? What were you keeping an eye on? And what was the reality, where you are?
Right. Yeah. So at that point, I had been following the studies coming out of Europe that were showing sort of very strange things, that not only were children not being severely affected by it, but they didn't appear to be transmitting it like adults were. Like kids before lockdown started who had, 188 contacts who had COVID, who didn't spread it to anyone. I don't know if you saw that out of France, but that was sort of an interesting first one. And then, right. There were multiple reports of schools that before they locked down, like in Ireland, that they also didn't see any transmission. And then, and then we were looking at the schools that had been opening and some data from Asia, and it was just looking like kids weren't really transmitting this like adults. And it was hard to understand why, if it was just something with the school setting, or, if it's the ACE2 receptors. And I think we still don't really understand why it might be that children are transmitting it less. But even then, over the summer, they were, reporting from Europe that kids weren't transmitting it to teachers, which was just so strange. And I don't know how much you might have followed along with the Dutch experience, but they have a very good website where they've been reporting all along what's been going on in their schools. And they really have not been doing much distancing, not really any masking, and they were not finding cases being linked to schools. And so they were doing a little bit more distancing in the older ages, but they, from the beginning, were noticing if spread was happening, it seemed to be from the teachers to the students. And that was kind of what they were watching out for. And so, it was July 11th, actually, I kind of put together all the data that I had analyzed. And I know you kind of did the same thing at the same time in July. You kind of were looking at the data.
I was a little behind you, but yeah, go on. Yeah.
So I made this really long post on Facebook. See, I used to be a lot more on Facebook, and I'm kind of relatively new to Twitter, but and I was talking about how I thought that schools, we really should be opening schools. It was the two things were coming together. The kids weren't spreading it a lot, and teachers appeared to be relatively safe when they were around the kids, and we just need to keep the teachers away from each other. And then the other issues of kids are not going to be learning, doing virtual learning, the mental health issues. I mean, I was talking about all that back then, and it was shared like 22,000 times, and suddenly all these people that I didn't know knew who I was, which was very bizarre. But then it was, when was it? The end of July, when our former president said, we need to open all the schools.
Yes.
And then everyone who loved my post hated me because like they were like, why? How can you want to open schools? You're right about everything that you've taught us about the pandemic and all the data you shared, but what you're sharing about schools is wrong. And I'm like, what is happening?
Yeah. So you felt it quite viscerally, this, I think many of us have noted this feeling that, the moment he said that, a lot of people could never come around to that idea simply because he endorsed it. He said it. Yes,
exactly. Yeah. It might have been the worst thing that happening for the school openings. I don't know, but
wow.
But yeah.
So then the fall came, and in your area, there were no schools?
Okay, so that's another great question. So we didn't really know what was happening in our public school district until days before the schools were opening. Maybe it was 2 weeks before, and then we're in the SCUSD, so the Sacramento school district, and then they said, okay, it's going to be virtual. And, I watched their little orientation. And at that time, I said to my husband, this is going to last a long time. Like, we are not going back anytime soon. So I had been actually advising the Catholic schools in the area, or been helping to, about how to reopen safely at that time. And I had been watching what was happening with them. And they were actually open for summer school all summer, and they hadn't had any cases. And so we decided to move our kids to Catholic school after about a month and a half because I have 2 stepkids that are older and then 2 younger kids. And both of the younger kids, they were getting Fs in school. And, my husband and I are both physicians, so we couldn't facilitate their learning. We just didn't want to quit our jobs to do that. And one was getting migraine headaches and the other one was like turning off his camera because he was too embarrassed. And they had both been getting all A's essentially before that. And it was just heartbreaking for me to see that they had no motivation. Their contact with their friends was gone. And luckily we were able to move them to a private school. But obviously, as you know, not all parents, not most parents have that option. So.
I mean, I think your story is a story that, I've heard quite frequently, which is that, it's natural that everyone will do what's best for their own children. I mean, that's just a natural thing. I think no one should be surprised that people do what's best for their children. And that means that, if you have the means and the ability, people will put their kids into in-person school. And, I think that's true of most of my colleagues who've talked to me about this. And that's true of, I think, a lot of people. I think you and I both recognize that it's also tougher on the kids that their parents don't have those kind of resources. And the school that will be left behind in the wake of all this is not going to be the same school as that was there before. But we could talk about that a little bit later. I want to jump to I get a sense of like where you came from on this issue. And I guess I came from it the same way. I guess my inclination was that of course kids would be spreaders. I mean, that's true of a lot of viruses. And of course that would be the case. But then the more you look at the literature, if you just looked at it from a neutral vantage, you found that was really not the case. And in fact, those contact tracing studies that came out of Europe were rather clear that they were half as likely to contract it when it was in the household. And then we just have a new study, seroprevalence in Germany, came out in JAMA today, or maybe JAMA Internal Medicine.
It came out the 22nd of January, and it showed that the kids had a third of the antibodies as the adults did.
Yes. So explain that finding.
That was an interesting study. I mean, I don't think it really looked at the question of how much they spread it. I think that was a little bit of a misunderstanding of that study and how they interpreted it. But there's been a study that hasn't gotten a lot of press that was from Greece, where they looked at a bunch of family clusters. I think it was 36 families, and there were 18 children involved who ended up being positive, and not a single one spread it to anyone else.
I see.
And that was that was interesting to me too.
Yeah.
But SARS-1, interestingly enough, and that's been found to be the same way, and it also uses the ACE2 receptors to enter the cells. So that's, I don't know. I think it's something different about the SARS-1 and 2 viruses. So
that's a good point. I think two things jump out at me, the contact tracing studies. One is, of course, once somebody in the household has it, you can trace it to other people, and so that we know kids are fast as likely to acquire it. And the other thing is just the paucity of the antecedent cases that are children. They're very few and far between of the identified case as a child. And the children that I think you are identifying are the ones with like rip-roaring infections with high viral load. So I think that makes some of these kind of interpretations of some of these studies difficult, because some studies claim that they are more likely to spread it. But I'm saying that you're not looking at the average kid who's got an infection.
Oh, exactly.
Yeah.
I totally agree. Like they're looking at the kids that are sick, and so few kids get sick. Right. And so if we're only measuring those kids, if they have the same as adults, then you would just be able to say, well, then on average, if only 1% of the kids are getting that sick, then probably most kids have much lower viral loads. But we don't know that. But yeah, a lot of people are saying that kids are spreading it, asymptomatically. And then we had that study from JAMA that shows that asymptomatic people are, only spread at 0.7% of the time. And now we're having more surveillance testing studies. I don't know if you just saw this one that was released. It was from like Zenelman, and he's from Johns Hopkins. It was just released like 2 days ago, and they looked at 4,500 kids, and they found that it was basically the same thing. There was no transmission from the kids to the teachers, and very limited transmission among the kids, very similar to what we found. But they were doing testing, even when kids were asymptomatic, and they found the same thing.
Blind testing. Yeah. I'm trying to recall that one. I might have seen it. Oh,
it's really new if you didn't see it.
Yeah, maybe I didn't see it. I guess I'm also tainted by, there are some nice studies that look at what happens when schools close and open, like that Germany study, because they had the staggered vacation schedules. And that's one that I like to cite because I think it actually can disambiguate the interventions from the school closure and the opening. But let's put these aside for a second. I mean, I guess I want to go back to that moment in time. But in the fall, I think Europe had a different commitment than the U.S. Europe's commitment was to try to make it happen. The U.S.'s commitment was to try to stick a finger in Trump's eye, I think. That also, explains to some degree the fact that the places that did open are places that vote strongly for Trump, and places that didn't open are places that don't vote for Trump, which creates this whole other second order of weird effects. Private schools opened. Children's daycare opened, and even in California, in-person daycare, in-person private schools, but public schools were not opened. And so a lot of data was coming out about, a lot of these daycares are running nonstop without any problems all this time, right? So there is this real-world data coming out even from our own state. Anyway, so this was the backdrop. I think I got interested in the question and I started to cover it more, and I wanted to think about it in terms of trade-offs. There are trade-offs. I think I'm willing to say, SARS-CoV-2 is not that much different than other respiratory viruses for children. I'm willing to say teachers do not have substantive higher risk of acquisition. I'm talking odds ratio 2 or higher. But do they have 1.3, 1.4, 1.2 odds ratio? I don't know the answer, but I think it's possible that it's slightly higher. But I think it can be mitigated, and I think it's not certainly less than taxi drivers, less than other people doing essential work. So that's one thing. And like when these odds ratios are rather modest. We're not talking about tobacco and smoking 20. We're talking about in the 1 to 2 ballpark. And then there's some studies that I think find no increased risk at all. The Sweden study. So I guess I'm willing to say there's a question mark there. But you have to factor in the impact to all the constituencies. What is it doing to the children? What is it doing to the parents? What is it doing to society? What is it doing to the teachers? And when you look at that totality, I think the answer is quite clear. But I want to jump to your recent study, because I think your recent study is, it's part of the reason I reached out to you, but I also thought it was really well done study. You went to I don't know if you physically went there, but you worked with people in Wisconsin, and you took a look at what was going on in Wisconsin. And Wisconsin made a concerted effort to get kids back in school in person. And there are some precautions they took, and then and this is really what happened, the experiment of what happens when you take these precautions. And the experiment went super well, and you published recently in the Morbidity, Mortality weekly reports of the CDC, and it got a lot of publicity. So I wonder if you might talk about your journey. How did you get involved in this project? What was the project, and what did you find, and that sort of stuff?
Yes. So it started out as it was going to be a masking study, but also looking at the prevalence of SARS-CoV-2 in the school, and how many cases there were, and then looking at how much spread there was in the school. And so I got involved in the study after it had already started. They were doing the data gathering, and a friend who was also a physician mom got me, connected to this Amy Falk, who's an amazing doctor in Wisconsin, who took the initiative to do this study really without any funding or backing to do this. She applied for a grant to get masks. She got $150,000. So wow. The kids in the study could have somewhere between 3 and 5 cloth masks. Okay. And then was going to look at, what the compliance was with wearing those masks. And my understanding from talking to her about it is part of the reason that the schools opened was because she got this grant. So they were kind of like a little bit on the fence about opening. But it's interesting because it's really in the middle of Trump country, which I think a lot of people don't know. I mean, it's a really conservative area of the state. Yeah. And so I don't think that there was a lot of masking going on in this area.
Outside of schools, right? I see what you're saying.
Right, exactly. Yeah. And so for those people who haven't read the study, I mean, the prevalence of, or the test positivity rate
rip-roaring.
40%.
40%. 4 out of every 10. That's rip-roaring, right? Is rip-roaring.
I know. Yeah. And I think about that, and I still know there were a lot of people who are in the community who are not getting tested. So, I'm sure there were people who are positive who weren't getting tested, but knowing what I know about what was going on in Wisconsin, because my parents live in Wisconsin, I know that there was, people weren't getting tested. It was still kind of, even this fall, considered a hoax by a lot of people. So I don't know, but there was a high positivity rate during the study. But they were able to get the kids to mask, which was really interesting. I mean, so we were compiling data about how often the kids were masking when they were in school. So it was greater than 90% of the time. It was the same for the elementary kids and the high school kids, which was also a surprise. So they were equally good at doing it. It was while they were indoors that we were figuring out if they were masking. While they were outdoors, so it says in the study they had to mask, but that is only if they were within 6 feet of someone who was outside of their cohort.
I see.
So that's a little clarification of that. But I got involved with the research group because they were looking for someone to sort of guide them on how to interpret the results and publish it and write it up. And, so I was really fortunate to get connected with them because I mean, I like you had been watching data come in from across our country that wasn't being published, that wasn't being peer reviewed. And it was, the YMCA is published in the New York Times. They have all these kids and nobody publishes it. And then multiple school districts all over the United States are publishing that they were able to open successfully, but there were no, the data was not available. The data were not available. And then, no one would publish it. Or no one would write it up to get it published. And I've thought a lot about what you've been saying on your show about how there's not a lot of incentive for researchers to publish in this particular space because, they might view it as a risk. Yeah. That they're taking a side or they're biased on something, or they, they'll get in trouble with liberals if they post or if they, have a study that suggests that, schools should be open and might be able to be made safe. And, I think you have a legitimate point there. And also really, who is out there that's an expert on COVID in schools? Like there's no one. We're all learning about this together.
I think that's a very important point. I obviously I agree with both. I think there's professional disincentives to speak on this issue, even though it's probably one of the most important issues of a generation. And I think history will view it as an important issue when all the harms of what they have done, these long-term protracted closures, start to manifest. People will say, what the hell did we do? And then I think it will have broad repercussions in the population. So I think there's that. And then I think we're not in a good moment. I mean, if you say anything on Twitter, you've seen, there's powerful forces on both sides that are happy to denigrate But let me say what one of the, I mean, there's a beautiful infographic of this. It says K through 12 schools have in-person learning with limited COVID spread. They say you use masks. They capped classes or cohorts at 11 to 12 students. The distances were maintained, you tell me, between the cohorts, not necessarily within the cohorts. And then there's quarantine after exposures. Teachers report 92% mask compliance in these groups. That's terrific. None of the teachers are vaccinated. It's important to state this is a non-vaccinated teacher group. And within 13 weeks of in-person learning, 7 out of 4,800 students and 0 out of 654 staff were known to have gotten COVID-19 at school. And this was at a place where the weekly incidence was 34 to 1,000 per 100,000 persons in the community. That is, I mean, I don't think people fully appreciate that. That's a brisk. That's one of the that's the briskest transmission in this I mean, it's a brisk transmission period. So I wonder if you might drill down a little bit on, you know, how did you all sort out if they got the COVID in the school versus out of the school? This is something that I see people always are critical of.
Oh, yeah, absolutely. And that was done through the state, the contact tracing through the public health department in collaboration with the school by looking at where the positives were that could have potentially, you know, infected that person. And so we did not have access to the data that involved individuals because of the way that our IRB was. So we were relying on, you know, what the school and the public health department had come up with as where the cases were contracted. So that's really, you know, I can't say much more.
No, but that's fine.
That.
I mean, I think there's a few things that I'm going to emphasize. The public health department is not in cahoots with anyone to get schools open. They're doing the way they always do it. And the same people who say that contact tracing is not good in these studies, I hear them say that, they're the same people who say that contact tracing can get us to COVID-0. So it's gotta be, they gotta believe in it at some point in their lives, right? Because I hear them saying, if we shut down for a long period of time, then we did test, taste, isolate, and contact trace, we'll be able to go to COVID-0, and then we can reopen, have a party. So if they say that, then they certainly believe it's an effective strategy. And then the last thing I'd say is, I don't think these public health contact tracers are missing a huge school outbreak. If all the kids in a class are getting sick and all their parents are sick, these public health departments are going to figure out it happened in school. But that didn't happen, right? I mean, they're not... The people who run this are good people, and they know what they're doing, and they've been doing this for a while. So for me, I find it's a disingenuous objection to your study to say, well, we don't know, the contact tracing is not that good because of these reasons. These are the same people who believe mightily in contact tracing, and I think it's unlikely to miss sort of, if all the teachers in a school got it, you know, from having a break room meeting or something like that, you know, I think it would have shown up. But okay, so you're relying on that.
Right. So yeah, I mean, obviously if there were major outbreaks coming from schools, I think we would be seeing them. And also it brings up the very important point that our study can't be looked at in isolation, because there have been many studies that have shown the exact same thing as ours. And I just have to bring up the study that was done in North Carolina, because that was almost 100,000 students and staff. And yeah, exactly, JAMA Pediatrics. And they also found no child to student to teacher transmission in that study. I think they had 78 cases out of 100,000 in that time. I mean, they had a lower prevalence than we did, but they found the same thing. The study from Baltimore that just came out, you know, they were actually doing the surveillance testing. They also found the same thing, no student to staff transmission, very limited in the class. They had, and the same in our own school district. I actually just talked to our district superintendent today. We've had the same pattern where in our school district and another, there was like a out of school party where kids got infected. So I've seen this twice now. And so all the kids come in, but they don't actually pass it on further, but they're found to be positive in the school because they were like at a party or a sleepover or something. And I think my understanding of what happened at the Georgia camp was actually the same thing, that all the kids got exposed by actually because the counselors had a party the couple days before that camp. Where they spread it to each other. So I've heard of different stories about the Georgia summer camp. But I mean, let me make another way to look at this situation in both these states. I mean, in Wisconsin, when you reopened schools, case rates were as high as 1 in 100, which is insane. In North Carolina, it was 1 to 2 per 1,000, which is also I describe as quite brisk. That's a brisk transmission. So if you've got 2 states with 1 in 100 COVID cases, new diagnoses,
1 in 1,000. What's the justification for closing schools? You've got rampant community transmission. And so you're closing schools, you're not, the rampant community transmission is still going on. So you're just punishing the kids who are not going to get that sick anyway while you're letting rampant community transmission go on. You see my point here? My point here is like, if there's rampant, I mean, one of the I've seen people say these things about these school studies. They say that, we can't trust, they never can trust anything that goes against their intuition, of course. That's okay. Well, I had no intuition, and then I looked and I saw things like the Germany study, which I think are like pretty causal. But the other way to look at the question is this, which is, if you're letting runaway community transmission occur in your state, then why not also open the schools so you get the benefit of schools? And it's unlikely you can go any faster than your foot all the way down on the accelerator pedal. You've already floored the car, right? You know what I mean? You're already having brisk transmission, and then the kids are half as likely to get it. It's not going to fuel it anymore. So closing the school while you have runaway transmission in a community, that's just spiting everybody. I mean, I don't see the value of that.
Yeah, no, exactly. And I think that even more to that point, I would add that in some places we're seeing that kids are getting COVID, more outside of school.
Yeah, when they're not
in school. And I can see as a parent why that is. And I think a lot of people who don't have kids don't understand why that is.
And tell me, and why do you think that's it? It's because they're hanging out by their friends.
Well, actually, it's not only that. So Our kids were in a daycare to do their virtual learning, and they were in one room with 40 kids.
Okay.
And so, and it wasn't just that. It's like then one of them didn't want to be in that daycare, so we moved him to a different daycare, and then so they were in 2 different daycares, and so then they're like even more exposure, and then people are passing the kids around between parents and aunts and grandparents and so kids, if they're not, 12 or older, they need to be somewhere while their parents are working. And so these families are like passing them around between everyone, and they're going, and if they, they have to pay extra money to get them in daycares and well, all that. So anyway, I can see how there would be increased exposure to these kids, on average when they're not in school. If schools are so safe. I mean, in schools, most of the schools that have been open and the school that our kids are in, they treat all the kids like as if they're positive all the time.
Right. Yes. They're very strict and they follow precautions. Yes.
Yeah, exactly. Right. Exactly. So of course the schools are, I don't know. Well, yeah, that's why I think it appears that schools might be safer for the average kid.
Yeah. I just want to highlight one thing you said, which is something that people have told me and that I'm aware of going on in the Bay Area, which is that there are some private companies that are renting the school space so that the kids can go to the school literally so they can connect on Wi-Fi on their laptop so their parents can go to work, which is like the dumbest thing I've ever heard in my life.
That's right. And they're very expensive, a lot of them.
Yeah. Oh, is that the case? I don't know that to be the case.
Yes, exactly.
Is it expensive?
Oh, yeah. I mean, the ones that I've read about, like, even the YMCA was $1,000 a week per kid.
A week?
Was it a week or a month?
Oh,
I think it was a month.
Okay,
it was a month. $1,000 a month per kid. Yeah, sorry.
$1,000 a week.
So it's been, so there is that concern that people are making money off of the fact that they're watching these kids, and it's a tough situation for parents. So yeah.
So I guess the takeaway message in your paper is, of course, that it can be done. These things can be done. 7 out of about 5,000 students and 0 out of 654 staff were known to have gotten COVID-19 at school based on the local public health contact tracing of that place. I wonder if it might be, just some ideas for you. I don't know if you've investigated, but one thing that I'd be interested in is to know surveys of families of these kids. Like, what do they think about it? How many people in the families have gotten sick with COVID in this time? And of course, a lot of them got sick because it's been rip-roaring in the community anyway. And how do they feel about that? Any thoughts for future work in this space?
So we're actually designing the next phase of the study right now. So I'd love to hear your ideas, but we are going to be doing surveillance testing, and we're actually going to be looking at the if we get enough tests done, if we can find, if the disease prevalence is high enough, which it probably won't be since no one seems to be getting infected in school, would be to look at, the difference between kids that are, distanced out 6 feet in the schools that have enough room and the kids that are not distanced out. But honestly, I just don't think we're going to have the power to find a difference.
Yeah, I don't know if you'll have power.
Cases are coming from schools, but
but you're talking about the 6 feet because, sorry, I mean, I just want to highlight to the listeners, the reason that you're interested in the 6 feet question is the 6 feet question is a serious barrier nationally to having schools reopen.
Yes, that's right. And I don't know if you would have been following along what the World Health Organization is saying, but they're saying 1 meter, which is 3.3 feet. And so my understanding is in Europe, in most of Europe, that's what they've been following. Although England, UK has been 1.5 meters. But we just don't really have solid data to know whether or not it needs to be 6 feet or 3 feet. But in our study, I will say that the elementary grades, they didn't have room to do the full 6 feet. So they basically used the space that they had within the cohorts, and they just kind of spaced out the kids. So it was kind of, and I've been kind of outspoken about the fact that I think that our results can be applicable to urban school districts as well, there was not as much space as the publication might have made it sound like there was. So
that's interesting. I guess I'm not an expert on these topics, but I guess I would say that the truth is, I think people don't know a lot of the answers to these questions. We don't know how far you need to keep them apart. We don't know what's better. They're different alternatives. Instead of keeping them apart, maybe you'll just commit to the fact that once they're in the same class, let them be kids like a normal class. Just let them have normal class. And then make the classes absolutely segregated from each other, or separated from each other, totally in their own bubble. So the classes don't cross each classes. That way, if anything happens in one class, the whole class is shut down. And then make the classes as small as you can. So take the teacher, spread them out, make them, 7 kids, 11 kids, 12 kids, whatever you can budget, and separate it, and then let those kids be kids within the group. I'm not saying this is the answer. I'm saying this is a hypothesis to test. The other thing I'm very interested in thinking about, again, I don't think anyone knows the answer, but the thing I'm interested in thinking about is that what is the stopping rule? And if the stopping rule is anybody in the class has anybody in their house who has COVID, that's a pretty brisk stopping rule. You're going to be stopping all the time, especially in places with rip-roaring community spread. If the stopping rule is anybody has an asymptomatic detection of PCR positivity, I'm not sure that's the right stopping rule either. I think the stopping rule has to be somebody in that class or the bubble around the class, the parents and the people who touch those, spend time with these kids, they are actually getting sick. And if 2 people in this bubble get sick, then I think it's suggestive that something's going on in that class. Maybe that's how it's been spread. But I think that, I don't have all the answers, but I do know that there has to be a will. There's no political will to open these schools. And if I were getting paid to sit at home and be on Zoom all day and never have to go to work, I can see the appeal of it. But unfortunately, I have to actually go to work and do it. And I do it. And I'm sure I'm at slightly higher risk than somebody who didn't have to go to work. And in my personal case, I actually was applying for a California medical license. I was starting during the time of COVID. And I pushed them very hard to get that license as fast as possible because I felt moral urgency to get back to my healthcare providing. Anyway.
Yeah, I agree. I don't have all the answers either. Okay. I've been studying this and I can report the science and I can report what the studies have been showing, but that doesn't mean you have every answer about how every school should open. But I totally agree that people have not been coming together on this issue to discuss how to make it happen in the best way possible. And not in the public schools. I would say in our private school situation, the parents and the school administrators and people have been coming together and looking at the science and talking about, how can we make this work, for the kids, for the staff. And we're missing that dialogue, with teachers and in the public school system and with the openings with that. And teachers are really, and public school, employees are really an outlier in this. And that's the whole strange thing that's been going on is, most professions, everyone goes back to work, obviously, because they don't have a choice. Otherwise, they're going to lose their job. And because of that fact, every workplace has been really struggling to figure out how to make things as safe as possible. But that struggle, it hasn't even started in the public schools, and it's very disappointing because obviously you and I don't have all the answers, discussing this. We don't work in schools, so we can't.
I guess I don't have all the answers, but I have a few answers, which is one, I think that the risk benefit favors opening the schools. You got to it's not should we do it, it's how can we do it? How can we do it? You have to do it in a way that you're learning as you do it. So you're trying new things and you're trying one thing at a time so you can see what it does before you switch all the things. That's been a mistake throughout this pandemic. You have to commit to doing it and you have to figure out how to do it. And then I think we have to get off this delusion that there's this world of zero risk. There's never a world of zero risk. There's always risks when you send your kids to school. There's always anytime you get off the couch, there's a risk. The question is what risks are acceptable. And these risks to the children are roughly acceptable. To the people who work there, I think, my hat is off to them. I think my hat was off to them before. I mean, I think being a teacher is a tough job, depending on the particular students you have to teach. But it's an essential job. It's a job that gives you real self-worth. It gives you value. And you know what? In this world, a lot of people wish they had a job where you felt really good about what you did at the end of the day. And I'm sure I'm confident you'd feel good about working with kids if you do that every day. Just like, I'm grateful to have my job where I take care of people, because I think it provides some modest benefit in this world. So I think the teachers have to be committed to doing it. I think we could have a whole nother hour about the unions. Your study, I think, is very helpful. I mean, people can be critical of different parts of the study, but the one thing you can't be critical of is you actually did this. You actually did this. You actually did this at this period of time. And this is what happened. You didn't have one whole classroom of people have everyone die in it. You didn't have that. You've excluded some things, you didn't have all these things that people fear could happen, did not happen. You have documented a certain rate based on the available public health institutions that were segregated from the investigator, so there is no crosstalk there. It is what it is. That is the way in which contact tracing works. And for the people who believe that contact tracing will get us to the zero COVID world, I say that with some skepticism. I don't think we're going to get there. This is the instrument that you want to use. And then the last thing I'd say is maybe tomorrow, we're talking right now on February 2nd, but on February 3rd, I have an article coming about, do we need the kids to be vaccinated before school can open? And I find it to be a ludicrous proposition for many reasons. But one reason is it's not going to happen until probably 2022. And you can't afford to close the schools any longer. And then I guess the last thought I'll leave you with, and then I'll let you have the last word. But the last thought I'll leave you with is, I think, I know Twitter has its own view of where people are psychologically, but I talk to lots of people from all around the country, and I have a different view of where they are psychologically. And I think where people are psychologically is that they want to move to normalcy in a risk mitigated way. We got to get back to doing these things like having schools and having some businesses and having some operations in a normal way, but we're willing to take some precautions. And if we continue to draw this line saying that we're not going to go back to normal, we're going to stay in this pause, I think increasingly people will not take it. I mean, I feel frustration among everyone I talk to across the political spectrum, from rural to urban, West Coast to East Coast. The only place that I see a different philosophy is on Twitter, where they have a very risk-averse view of the world. They don't want to talk about trade-offs. They only want to talk about absolutism. But absolutism is always, I think, flawed in all its forms. I'll leave you with the last word. So any final thoughts on this topic?
Yeah. Oh, gosh, there was so much there. A lot of good stuff. So, I mean, okay. So I want to talk about teachers first. And I just want to say that, I have so much respect for teachers too. And I had really hoped with doing, the research study and all the research that I've been doing that this would be helpful to teachers, that it would be reassuring, that they would, I think a lot of teachers want to get back into the classroom. And, I don't know. I think that there are a lot of barriers that are being created by this, the fear narrative that's spreading around. And I also respect, teachers for being afraid, but I do think it's, it's stopping things from progressing with this discussion. And, I think that teachers, if there are any teachers listening, I would say that I have so much respect for teachers and what they do, and that, they should be, reassured by the data of our study, and that, kids are not spreading it like we were fearing. And then, I would just also say that we have to look at other countries and what they're doing and why they might be taking care of kids the way that they are. And because even in the UK, I heard that they said today that they're going to be reopening their schools with the new variant. And that has kind of been the attitude all along, that the schools have to be, the last thing to close. And in the US, I really think that we're getting that wrong. And kids cannot speak up for themselves. And so we have to remember that when they're suffering and they're not able to be in school and play sports and things like that, that, we're not always hearing that side of the story. And, I think in medicine, we're used to kind of standing up for vulnerable and people who don't have voices. So I think we all have to remember that might be why most other, all of the first world countries are prioritizing opening the schools, because they realize how important it is for kids. So, yeah.
Dr. Høeg, thank you so much for doing this. Thank you for this really interesting paper and for the discussion.
Thank you.
You've been listening to Season 3 of Plenary Session. Plenary Session is produced by Kiana Klossner. Music by Ian Straley and Audrey Tran. The views expressed on Plenary Session are those of whoever said it and no one else. Plenary Session is not medical advice. Follow us on Twitter at plenary_session. Until next time.